Namaste. This is Rakhi Patil. Welcome to RAAKHE Connects and my Nritya Samarpanam series episode covering the topic Expressive Arts Therapy. Today I welcome Mrs. Shashi Ramesh. She is a teacher and a student of classical dance and music. She has completed her Masters in Fine Arts, that is MFA, in Bharatanatyam from Kavikulaguru Kalidas Sanskrit Vidyalaya, Nagpur, with the gold medal. This MFA was pursued under SNA awardee Dr. Sandhya Purechaji, who heads the Bharata College of Fine Arts and Research Center, which is affiliated to the university in Nagpur. She still continues her Bharatanatyam training under her guru Natyarani Shantala, Dr. Vasundhara Doraswamy from Mysore. She is the founder and creative director of LOITA, that is Lavanya Institute of Traditional Arts, which offers courses in classical dances and music courses certified by the Government of India. She has secured the third rank in her MA in economics course, which she did from Mysore University, and has been a part of the marketing team with the Times of India for a few years in Kolkata and Mumbai. She had been a kindergarten teacher with SM Sethi High School for a while, which actually sowed the seeds of working with children with special needs. I again welcome Mrs. Shashi Ramesh. Namaste. Before starting, Shashi ji, I once again thank you for accepting my invitation to RAAKHE Connects and wishing you a very happy Women's Day. May you have a great day and enjoy your day.
Thank you so much. Rakhi ji is wonderful, and Rakhi Connects. It's all about actually making connections in this world,
True.
and it's a lovely name. Thank you so much for having
Thank
me
you so
here.
much.
Yes, have a wonderful, wonderful day yourself.
Let's get started. Can you tell us like about this expressive arts therapy and what is it exactly?
So, expressive arts therapy, as the word is as it is, it's using different forms of art to use as therapy, and which helps people to express themselves in a very healthy manner.
Okay.
So we use different modalities like dance, music, art, working with colors, and drama.
Okay.
There are other creative arts like writing, puppetry, using clay, pottery. I mean, anything that is available, especially online. People could not go out and do much stuff. So what was
Okay.
available in the house, people have been able to use that
Yes.
and express themselves. So it's a form of therapy that uses different arts.
Oh, okay, great. And so how do we practice it?
So one has to be really trained to facilitate. We actually practice in the way that we help facilitate a session. It could be a
Okay.
group session, it could be one-on-one. And we ask them to use some materials, like if it's just dance movement, then we're of course using our body.
Right.
If it's music, we can use an instrument if they have at home, or something that
Right.
we can help them make an instrument. It's just very creative process.
Right.
For art, of course, any colors, and for drama, of course, again,
Yes.
some props can be used, and our bodies. So
Oh,
yeah, we use all modalities, and of course everybody has writing material at home, so we also, facilitate writing things down, so they express themselves even that way.
okay. So can you elaborate more, like how do we use it?
So anyone and everyone can
Okay.
actually participate in either a group session or one-on-one, like I
Right.
said.
Right.
And you don't have to be a dancer or a musician or a great artist,
Oh, okay.
or even an actor. It's all there within us.
Okay.
The fact that even the cavemen did art in the caves, that
Yes.
they danced around fire, it's like it's already there. The rhythms are already there within
Yes.
us. It's
Yes.
just that we need to bring it out and
Okay.
help that to, kind of, I won't say treat, but help that to help them
Okay.
surface all the deep seated emotions
Okay.
that may manifest into certain behaviors that lead to maybe a physiological challenge or a physical challenge or a mental health challenge. So it just helps them, kind of express themselves about things that we are asked in society like ours not to talk about. So when they're not able to talk about things, see, counseling and psychological counseling, people were able to talk things, but it's also a taboo. That's also stigma even now. I mean, talk therapy has been there ever since. And पुराने ज़माने में होता था कि जाओ दादी से बात कर लो, and dadi would say certain things and words of wisdom would. So it would be like a talk therapy. And they were in like community homes, like joint families, so हमेशा कुछ ना कुछ wisdom मिल जाता था. Abhi everything is like nuclear families, and the mother, father, everybody is busy, and the grandparents, most households are not around. They probably are in the village leading their quiet lives, or some of them in old age homes. So there is no wholesome as such atmosphere, like everything is like just so much just within 4 or 5 people. And sometimes these things, when let's say a mother is busy and she doesn't want to talk about certain things, she's tired and she said chup baitho, and they're asked to not talk about things, that's when it just gets deep seated, especially things like sexual abuse in families by family members, marital rapes, things that we are not able to talk about, gender, sexual preferences. So certain things that are not talked about can slowly emerge with these processes. It will help them identify themselves and connect within themselves what actually is there inside, and they're able to express it in a very healthy way, acknowledge it, accept it. It's very important,
Right. Very true. So it can be like a counseling kind of thing, or similar to counseling, or something different.
We don't really counsel. Counsel means to be able to help them, guide them. We just provide a space that is safe for them to express themselves. They may talk about it, they may write about it, but for them to understand. And we as facilitators are able to, in that process or in an intervention, we are able to identify what could be a root cause of an X problem. Let's say wetting in children, let's say nail biting, stuttering, stammering, a fear of exams, a fear of, right now fear has really taken over the world. I mean, everybody's so scared, or lost a family member. So these are certain things that children don't talk about, and they face it and they really don't know how to express it. And uh, since I said it's a nuclear family, children are really exposed to a lot of things. And there is the digital media, there is TV, there's all kinds of information coming to them. And they are not equipped to process all that. And parents may not have the time to explain it to them. So they seek again, their peer groups and things like that, who are probably in the same stage and same age, or maybe a little older, like an older brother, sister. But again, it's misinformation. So for them to be able to connect with themselves and maybe heal themselves from certain trauma. I'm not saying everybody, but those who go through it, expressive arts therapy is extremely useful. And that's how we use it. We use it with, let's say, children or young adults on the autism spectrum disorder, like ASD, we talk about. We use it for the older population in not just old age homes, but even for, Alzheimer's, or, any of the degenerative conditions of the brain. With age. So we are able to use different modalities like music therapy. So we decide as to, after consultation, we decide, okay, this might be a good course of action. So it could be like 3 months, 6 months. It's like a prescribed thing. And then we go, as we go along, we are able to, kind of see what's the development and what's the change. And this is not counseling. This is without talking.
Yeah, because this may be a
Interesting.
question, people might, have a doubt. So I just thought of like, clearing with you. Yes, I think so. You told, but again, like, I want to elaborate, like, exactly like who can participate in this. Like, is it only the for a patient? Like, I won't say exactly the patient, but the we should not call them as a patient. But yes, the children or the people who are facing these problems, only these people can participate.
No, actually, like I said, when we say normal, we say neurotypical people, like of
Okay,
all ages, of all
okay,
genders can
okay,
participate.
okay.
You don't have to have a problem, but it would be great to kind of just have a one-off in case you want to experience. It's more of an experiential session, each
Okay.
one of them, because we're using modalities that is art. Art cannot be really just talked about. It has to be
Right,
experienced.
right,
This is
right.
not about knowing Bharatanatyam. This is not about knowing how to draw. This is
Oh,
really not about
okay.
knowing how to play an instrument or things like that. Or you don't have to know
Okay.
techniques of acting and all
Oh,
that. It is
yeah.
just that we provide that space and we are trained to use different techniques and many theories that have,
Right.
been developed. And this has been there like 50, 60 years now abroad in US, UK and all. And they have master's programs there. And it's amazing the volume of
Wow.
work that's been done with, patients. Yes, patients, psychiatric wards have been, using this kind of modality
Okay.
where people have gone in, experts and therapists have gone in and worked. They have worked in jails with inmates, people who
Oh,
have committed
okay.
crimes. Yes. So because crime is committed by people who have been victims of, it's a cycle, right? It's a cycle.
Right,
You
right,
do
right,
what
right,
is done to you. Yes, so there
right,
are many, many ways of, approaching that. Like I said, from a problem like
right.
bed to relationship problems to
True.
corporate, the stress, especially the stress, my God. So when I work with hospitals and I work with even professionals and corporates,
Right.
it's the main issue, and people face stress day in and day out. I mean, we all
Human
went through
stress.
stress globally. We
Right.
all went through stress globally with corona, and we went
Very
through
true.
fear. So it was a time when people froze. People basically just became numb as to what's going to happen. So, and that was a time we all were really working and,
Right.
a lot of work. And it was great just to know that, uh, we are equipped to provide that space for them. It's
Right.
really, it's a gift, I think. It's a gift.
Yes. Yes. True. So just one more clarification I just wanted. Is it like any normal, human also can, experience this um, expressive arts therapy?
Yes. So
I mean,
let's say,
anybody can just experience it and feel it
it,
according to
yes,
their.
anyone can, because it depends. You can do it in a group. I do it for my kids from Lyota. Sometimes I just do
Okay,
one-on-one. If I feel that somebody's not really learning properly or the pace is very
okay,
slow, so
okay,
I just say, you know what, let's have a small session, and then I take the
right,
permission, of course, from the parents. And
right,
since it's Zoom, we know that people are there watching. It's
true,
nothing like
true,
we're doing
true,
unearthly or something different, but it is different in a way. So we just ask them, and then something emerges. The fears emerge, and
okay,
then
yeah,
okay, so they have to deal with this all by themselves. And mother is in a room working, and father's in a room working on their Zoom, on their work from home situation. The kid is really left to their own device, and how do they keep busy? So enrolling them into one class
right,
and another class, and then you expect them to do a lot of things on their own. Suddenly they're grown up and they have to
right,
take a lot of responsibility. अभी तुम संभालो, ये Zoom ऐसे करना है, वैसे करना है, email check करना है.
right,
At home. It is, see, for us it was different. For kids it was harder, and for other people who are facing already some physical challenges and mental challenges for them, mental health challenges, it's very
right,
difficult.
right,
I'm also talking about people on wheelchairs, for example. They were not able to go anywhere. For them, this was very useful because all they had to do is come in front of the screen and they would have their sessions, which was
yes, yes,
fantastic. So it was nice that it was available to a whole lot of range of people. And
Yeah.
I wish more and more people are able to, experience this.
Yes.
There has been dance movement therapy. Like I said, all these are different forms of therapy already in use. There
Yes.
has been dance
Yes.
movement therapy, music
Yes.
therapy, art therapy. Very, very powerful techniques have been, devised, and a lot of theory backing up, psychological theories backing up.
Okay.
So it's amazing that it's all put together, and then you're able to kind of
Yes.
decide, sometimes impromptu, depending on what. So
Okay.
we can't say like an X person, let's say a person X is there and this has this condition of the body or
Right.
physiology or mind, and this is the chartered route. No, it's
Okay.
how the person feels on that day when they walk in on Zoom or even otherwise in a physical space.
Right.
We decide and then we go along with that.
Yeah. Great. Great. So, what do you do after you facilitate such groups and individuals and listening to their stories and their lives, which must be hard, I think so. So, how do you face that?
Good question. So we take on so many things. I mean,
Right.
it's not just technically done. We listen to
Yeah.
them. We have to be very keen
Yes.
listeners. And then if they are not talking, we have to be very good observers.
True.
We have to be able to witness things that are not said, but we have to witness in their
Yes.
body what's going on,
Yes.
in their artwork what's going on. We take on a lot, and it also sometimes triggers within us because we
True.
may have also gone through something like this, but our behavior did not kind of it didn't
Right.
manifest into something really
Right.
that difficult that we cannot go about our lives the way things would be called normal. So we take on a lot. We are also trained to do certain processes after that. We also have our supervisions. We have our own counselors. We go to if something has really triggered us, because we when we get into that space, we have to be 100% clear of our baggage, and we need to just keep that sorted.
True.
We need to be completely present for the group or the person who's in front of us as a client, even
Right.
on Zoom.
Right.
So you just keep everything aside and be there for that person for 100% for that client. And
Right.
so we do our own work behind. And some of us also can, let's say go for a walk or maybe swim. Or for
Okay.
me personally, it's cooking. I love cooking.
Okay.
Uh, I love to preserve things. So I pickle everything that comes my way, and my family always says, "Look,
Oh,
anything she'll pickle." So I like
right.
that. I mangoes, lime, even karela, anything I just
Oh,
pickle.
wow.
So for me, cooking for me is therapeutic. It's really therapeutic. I just enter the kitchen and I'm all calm and nice. So yeah, we also do our own other processes
Right.
after this
Of
because
course. Of
there's
course.
so much going on. It's hard not to be affected. And
Yes.
we don't
Yes.
say we don't want to get affected, because doctors who treat, we think that they're not affected. They're affected, but they learn to deal with that. They have
True.
their processes and ways to deal with
True.
that.
True. Yes. Now, I just want you to share some valuable words from you or any advice, like uh, for those who will be watching this and the videos and the viewers basically.
um, I have interacted with many people, men, women,
Okay.
kids, worked at hospitals. Before the lockdown, also this work was going on for several years now. I've been doing a lot of dancing, singing
Right.
with patients with mental health challenges.
True.
Even we've gone to Dharavi and we've worked with women there who
Right.
have
Right.
who are kind of physically abused every day. So uh, and I've also been with corporates professionals who we all tend to suppress a lot of things.
Yeah.
We and we If that becomes a habit, we just keep pressing it down. Okay, everything is normal, so let me not show. So the mask that we wear for this, a mask
Right.
as a
Right.
dancer, a mask as a mother, a mask as a, so these are different roles also we are playing, but sometimes we
Yes.
don't we're not able to kind of there's a fine line between all
Yes,
these roles that
yes,
we play. And sometimes we as women, especially, also tend to just, brush it aside or brush it under the carpet, or it's okay, it's not
yes,
such a big deal if, our child was touched by somebody. Don't talk about it. Or, so many things that happen. We just say it's not a big deal and it's just deal with it and be strong about it. I feel that my advice, well, advice is a huge word, but I think that if you see anything different in any of the family members or even in yourself, if you feel that this is like out of normal behavior, I think
right.
it's just good to seek help. Talk to somebody. It's not just
Yes,
about expressive arts therapy. It's just about talk to
absolutely
somebody.
right.
You need to
Yeah,
just take a step back and understand the
yes,
balance in life, and the stress is always going to be there. It's how you deal with it.
right.
um, Find your methods to
Yes,
meditate. It's easier said than done,
right.
but that's what it is. We just seek help is what I would actually say. Yeah.
Yes,
And even if it's a problem like people don't want to talk about it, people don't want to talk about um suicidal thoughts or ideation. People don't want to talk about it. They don't want to tell them, their family members also, they won't
yes,
share.
yes, yes.
And especially now, for me, my child has grown up, but whenever there's some parent talking कि मेरे बच्चे का 10th board है या
Right,
12th board है, for me
right,
that
right,
triggers something, and I'm thinking, oh my god, that kid is going to be under a lot of pressure
right,
because the parents are going to say आपको 90% से कम लाना नहीं है. So it bothers me as a person saying that, allow them to be, and
right.
everybody's stressed out about it. It's
True.
not about blaming a system. It's about just being able to stay focused and balanced. I think that is key. So if you see anything out of the
Right,
regular,
right,
it's better to just seek help and take help from people and talk
great.
about it to you. I mean, once things work out for
Right,
your
right.
family, share it with your people, share it with your neighbors, share it because when you share it, you never know how you're helping somebody else, because somebody will
Right,
then approach you, say, hey, somebody like this is in my family too, and please help, please give the doctor's number.
right.
So we need to talk a little more about it and share. Yeah.
So actually now coming to one basic question, like how did you get introduced to this expressive arts therapy, or how did you get acknowledged with this thing?
So I must tell you, this is a funny little story. Once I was a mother, once you're a new mother, you just get so attached to the baby.
Yeah,
And when she was ready to go to school, she was
okay.
about 2.5 years old. She was ready to go to school. I couldn't leave. I couldn't
Yeah,
allow her to go to school. So what I did was the next best thing, how to stay close to her. So I became a kindergarten teacher. So there was a problem there for me. There
concern,
was a
concern.
children outgrow that need. They cry 1 or 2 days at school and things like that, and then they'll know that this is how it works, and that's about it.
Right,
But the need for me was there too. So anyway, I joined the school. It was SM Shetty School in Powai, and they had just brand new opened the school. I joined that and I got a job. I was also in marketing, so I had
right,
good uh,
right,
qualifications for
right,
that.
right,
So I did that, and as I taught there were 1 or 2 kids who were in class,
right,
and very different in behavior. And other children used to laugh at the kid, and that kid used to, seek more attention. So I knew that there was something different, because for me, I had only seen my child and some other children around who all
right.
seemed to be normal. So for me, that triggered a big thing, that there
Oh,
must be so many like this. And that's when I actually started reading a lot and
okay,
trying to, I read a lot, and I worked with my daughter who had started stuttering very, very slightly, but didn't get to the bottom of it because so many
okay,
questions, why, but I never got to the bottom of that. But then using different things at home, playful, it's just think about playful, it's being about
right,
being playful, being creative, just being there for
right.
them, when they need. So, and once that happened, I mean, the thirst for knowledge grew. It was just like one thing after
True.
the other. And once being a dancer, like being into Bharatanatyam for
Yes,
so many
of
years,
course.
I knew that even when I was going through a lot in my life, I knew that somehow dance was helping me, but I didn't know what. Was it the stamping? Was it the
Right.
mudras? Was it the neck? Was it eyes? Or was it the whole
Right.
thing? Was it the prayers that go along? Was it the music that comes with it? So I
Right.
didn't know what was working. So every time I went back to dancing, I felt great in life. And I'm sure all dancers and artists will vouch for that when they go back to their
Right.
core, which is their being a dancer, a singer, an artist, they will feel great, and then nothing affects them in life, you know. So I went to New Zealand to do a dance movement
Oh,
therapy
okay.
certificate course, and I did a few modules there, especially related to children, because that thing was the back of my mind. I need to
Wow.
kind of work with them. And then I worked with Hasina Hospital for a couple of years, and
Okay.
did a lot of work with the clients there. And then
Okay.
one-on-one, I've had clients. And then, of course, when the lockdown came in, and my
Yes.
approach to every person is like there is always a study there. There's always an observation. There's always something that you so powerful about somebody just walking.
Right.
There's so something powerful about somebody speaking, I think. Uh, Everything. There's music and dance and art and drama. For
Right.
example, we talking like this. I won't say it's an act, but there is something of an actor there. There is something of
Right.
a artist there. There is something of musicality in just the way we are talking. Yes, I believe that. So that's when the seed was sown, and it's now come a full circle.
Right.
Of course, my mentor, Miss Devika Mehta, she has done a master's in dance movement therapy,
Okay.
and she came back and she started a fantastic program in St. Xavier's, Mumbai University.
Right.
She's director of that course under the psychology department
Right.
under Miss Ruby. It's an amazing program. I think we need lots and lots of people doing this. It's a regular program, and it just opens your eyes to a new world. And the world is right inside us,
Yes.
but it just opens us to
True.
different ways to reach inside, and just be able to just connect ourselves and others. And this program is a PG diploma, like a postgraduate diploma
Okay.
course.
Oh,
And
okay.
of course, that's why we are practitioners. To become a therapist, you need a master's, which I'm sure she'll go ahead and start one soon. Fingers crossed. And there's, of course, there's no end to this learning. There's no
True.
end to this. I think it's a
Right.
fantastic program. People should join this, and just have it as a tool to be able to provide space for everybody who needs it.
Yes. Now, for everyone, how does one get in touch with you for this therapy?
Oh well, it is. We are just revamping our website and things like that, because Lyota so far was a dance and music school, but now
Yes.
I'm also adding a wellness aspect to it. So we have the expressive arts therapy. We
Right.
have other these two coming on, and we have experts to sit on the panel with
Yes.
also a regular psychologist, like a psychologist, a counselor. We have
Right.
other people who's joining
Right.
in also.
Right. Right. Right.
Shubprasad sir is with us because he's also a music therapist. He has also been able
Okay.
to train
Right.
there. He's there on the team too. It's just amazing that we are gathering around and collaborating and getting a system ready where we can just be there to serve. Yeah.
Right. Right.
So, or they can just Google Lyota. At least the numbers are still over. We are revamping the website, the numbers
Right.
still all over. So it's turning into something nice, and I'm just excited about this.
Yes. Now, so being Women's Day, what are your thoughts for this special
Hmm, interesting
day?
question. So I have been being a woman. I think I think I think it's just a day that is a reminder, basically, for all those people who don't remember the
Absolutely.
past. I do it every day. Like I get up and say, okay, there's something to do, and it's something like a reminder. Like each woman wishes another woman on this day. which I find really wonderful. And I love the graphics of very different, wishes that are coming along. I said, this is wonderful. This is lovely. It's nice to receive that. It's nice to have Women's Day, Grandparents' Day, Rose Day, Teachers' Day. It's just we are so busy that sometimes we don't, remember the value that's been given. So it's nice to be able to get reminded of that, even if it's just once a year.
I think so.
Well,
It was
for
a
the whole
great
year.
session. And
Thank you so much for
yes,
having
we'll
me
look
here.
forward again to have such more sessions with you. Thank you, Shashi ji, for your valuable time, your valuable words, and I'm glad you accepted my invitation once again. Thank you so much.
Thank you so much for having me here, first of all. And as far as valuable work, there's a lot to be done. And it's just wonderful being here. Thank you so much that I got a chance to express myself.
Yes, thank you so much once again.